In this podcast episode, Dr. Roger Seheult discusses the importance of sleep and its impact on immune system health. He emphasizes that sleep is crucial for maintaining a healthy immune system, as studies have shown that lack of sleep can lead to decreased antibody response after vaccination and increased susceptibility to infections. He also highlights the role of cortisol levels, slow-wave sleep, and melatonin in supporting immune health, and emphasizes the need for at least 7 hours of sleep to feel well rested. Dr. Seheult explains that the first few hours of sleep before midnight are particularly important as they are associated with slow-wave sleep and growth hormone secretion. He discusses the impact of circadian rhythm on sleep patterns and emphasizes the need to go to bed early to ensure adequate restorative sleep. He also addresses the negative effects of exposure to bright light at night and the importance of natural light exposure in the morning to regulate circadian rhythm. Dr. Seheult expresses frustration with the lack of natural light in hospital settings, particularly in intensive care units, and highlights the importance of natural light for overall health. He discusses the potential benefits of natural light exposure in reducing the risk of seasonal affective disorder and improving overall health. The discussion then shifts to the impact of diet on inflammation and immune system health. Dr. Seheult explains the connection between red meat consumption and inflammation, particularly in relation to the presence of sialic acids in animal products. He emphasizes the importance of minimizing processed foods and consuming a diet rich in antioxidants to reduce oxidative stress and inflammation. Dr. Seheult introduces the concept of intermittent fasting or time-restricted feeding as a way to improve metabolic health and reduce inflammation. He explains that restricting the time window for eating to 8 to 10 hours a day can lead to significant improvements in metabolic function, inflammation, and even hemoglobin A1C levels in diabetes. Dr. Seheult discusses a study conducted in China that demonstrated a 20% reduction in hemoglobin A1C levels in diabetic patients following a time-restricted eating regimen. He explains that the timing of meals, specifically avoiding eating close to bedtime and allowing for a longer fasting period, can contribute to improved health outcomes. Dr. Seheult recommends 2 variations of time-restricted eating, either having an early breakfast and a late lunch or an early dinner, to align with the body's natural rhythms and optimize the fasting period. The conversation shifts to the potential benefits of heat therapy in enhancing the body's innate immune system. Dr. Seheult references research indicating that raising body temperature can increase the production of interferon, a key component of the innate immune response. He draws parallels to historical practices of using heat to induce fever in patients with certain conditions, highlighting the potential for heat therapy to support immune function, particularly in the early stages of illness. Dr. Seheult emphasizes the importance of cooling down after heat exposure to lock in the benefits and facilitate immune system activation. The discussion delves into cultural and historical practices related to heat therapy and lifestyle interventions. Dr. Seheult acknowledges the prevalence of heat-based therapies in various cultures, such as the use of saunas in Finland and other traditional practices in different regions. He highlights the historical use of heat therapy in treating neurosyphilis and the positive outcomes observed, underscoring the potential of these approaches in supporting overall health and immune function. Additionally, he references the contrast between Western and Eastern medicine, emphasizing the value of integrating lifestyle-based approaches with conventional medical interventions. Dr. Seheult reflects on the role of prevention and lifestyle medicine in his practice, noting a shift in focus towards promoting healthy living and preventing illness, particularly in the context of the COVID-19 pandemic. He acknowledges the impact of lifestyle-related factors on the development of critical illnesses and emphasizes the importance of educating patients and families about the long-term implications of lifestyle choices. Dr. Seheult underscores the need to prioritize quality of life and holistic well-being, rather than solely focusing on prolonging life through medical interventions. The conversation addresses the accessibility and affordability of lifestyle-based interventions for individuals from diverse socioeconomic backgrounds. Dr. Seheult emphasizes the cost-effectiveness of certain approaches, such as time-restricted eating and natural light exposure, which can be accessible to many people. He acknowledges the challenges faced by individuals in low socioeconomic groups, but emphasizes the potential for simple lifestyle modifications to improve health outcomes. Dr. Seheult advocates for making good health accessible to everyone and highlights the importance of physicians in promoting and facilitating lifestyle-based interventions for all individuals. Dr. Seheult explains that hot and cold therapy can be easily applied at home using simple methods such as heating up a wet towel and applying it on the body, or putting feet in a hot foot bath. He emphasizes the importance of increasing body temperature and then cooling down to stimulate the immune system. He also shares anecdotal evidence of patients with COVID-19 experiencing symptom relief after using hot and cold therapy. Dr. Seheult discusses the connection between stress and inflammation, highlighting the impact of chronic stress on the immune system. He explains how stress can lead to cortisol receptor resistance, affecting the body's ability to fight infections. He emphasizes the need to manage stress to support immune health and overall well-being. Dr. Seheult highlights the need for individuals to take time for self-reflection and relaxation to reduce stress levels. He suggests being part of a supportive community and engaging in activities that promote mental well-being as effective strategies for managing stress. The podcast delves into the effects of fear and anxiety on the immune system, citing a study that examined the impact of fear on students during exam periods. The study revealed an increase in depression scores and inflammatory markers in the control group, while moderate exercise helped reduce depression and inflammation. Dr. Seheult emphasizes the importance of exercise in managing fear and anxiety, recommending moderate intensity exercise as a beneficial approach. He also discusses the benefits of nature on the immune system, citing studies that demonstrate the immune-boosting effects of phytoncides, aromatic compounds released by trees. He shares the findings of a study where exposure to phytoncides in a forest environment led to an increase in immune markers and a reduction in stress levels. The podcast highlights the potential benefits of spending time in nature to support immune health and reduce stress. Dr. Seheult provides insights into the role of vitamin D in supporting immune function and reducing the risk of infections. He explains that vitamin D plays a crucial role in modulating the immune system and highlights the importance of maintaining optimal vitamin D levels, especially during the winter months when sunlight exposure is limited. He recommends supplementation with vitamin D, particularly for individuals at risk of deficiency, and suggests getting regular vitamin D level tests to monitor and optimize vitamin D status. Dr. Seheult introduces the concept of the Swiss cheese model, emphasizing the need for a multifaceted approach to health and immune support. He explains that just like multiple layers of Swiss cheese provide better protection, incorporating various lifestyle factors such as sleep, stress management, exercise, and nutrition can collectively contribute to reducing inflammation and supporting immune health. Dr. Seheult encourages individuals to take control of their health and well-being by developing an internal locus of control. He emphasizes the need for personal accountability and the ability to make conscious choices that support immune health and reduce inflammation. He also suggests seeking support from friends and family to hold oneself accountable for implementing healthy lifestyle practices.